He was born with a bad heart valve, and Paul Sykes knew someday he'd have to have it replaced.
I was getting a lot of pain, a lot of chest pain.
Sykes loves to run.
One day I then went home after a run and I fainted, which was the point at which I realized that surgery was not very far away.
One of the reasons he chose cardiac surgeon Joseph Lamelas was because of his approach to cardiac surgeries. Lamelas specializes in minimally invasive heart surgery, meaning instead of cracking the patient's ribs, he makes a small cut between them, just 2 inches long. Then he navigates the area using tiny cameras, minimizing trauma to the tissue.
The recovery time for traditional open heart operation is about 4 to 6 weeks, and it could be as long as 8 weeks. For a minimally invasive operation, the average is 2 to 3 weeks.
And here he is, Sykes happily lacing up his running shoes just 4 weeks later.
That first run was such a great feeling not to have the chest pains anymore.
Dr. Lamelas says with traditional surgery, Sykes may never have been able to run comfortably again.
Some of the patients have more discomfort long-term as well.
For Sykes, the real proof of victory came when just a few months later, he crossed the finish line at the New York City Marathon.
My first thought was just sheer satisfaction, pride, joy.
And now on to the Miami Marathon.